Thanks, Andrew. I'm Ginger Heidel with the Coastal Health District, and tonight we're going to be talking about vaccines for COVID and flu. And I am joined by our District Health Director, Dr. Bonzo Reddick. Thank you for joining us tonight.
Thank you very much for having me.
Sure. So let's start with the COVID vaccine. There was some uncertainty initially about who was going to be eligible to get that updated vaccine this year. What can you tell us about who can get that vaccine?
So very simple answer. Anybody over 6 months of age who wants to get the vaccine after receiving information about the risk and benefits. So a lot of the concerns about would you need to have a prescription from somebody to get it, that's out the window. If you want to receive the vaccine and you receive information about the risk and benefits of it, you can then receive the vaccine.
So I want to say that one more time for the people in the back. No prescription is necessary.
No prescription necessary.
Okay, great. That's good to clear that up. One thing I have heard people ask is why another vaccine for COVID? I was out shopping the other day, overheard someone talking about the vaccine, and she said, I've gotten several booster shots. I'm good. I don't need any more. So why are we seeing another vaccine for COVID?
So COVID has become very similar to the flu. So everybody's used to around flu season, fall time when it starts to get cool, flu season pops up, people start catching influenza, and the flu virus mutates or changes every year. COVID is the same way. So last year's flu shot won't work for this year's influenza that's around in the community. Similarly, the old COVID vaccines don't cover the current virus quite as good as the new one that's out right now. So COVID's become kind of like the flu. Every fall, you just kind of get your flu shot, you get your COVID shot.
So this is something we should kind of expect going forward, that it's just another of those respiratory viruses that we may want to get an updated vaccine in the fall.
Absolutely.
Okay, so you mentioned flu, so let's talk about flu vaccine for a minute. Who should really consider getting a flu vaccination?
So similar to COVID, anybody 6 months and older who wants to get the flu shot should get it. In particular, people who are kind of in that 6 months to 5 years range, and also people over age 65 are really at the highest risk for severe complications from flu. But there's a lot of people in between that are still at high risk for flu. That could be people with asthma or lung problems, people with immune system problems, smokers, people with diabetes. A lot of folks in America actually are high risk for influenza and don't realize it.
And I got my COVID shot today, so got to impress the boss here. And I've had my flu vaccine too. And for me, part of the reason I did that was because I've got family gatherings coming up, and there are people in my family who are immune compromised. Is that another thing people should consider? Not just their own health, but who they're going to be with this fall.
Absolutely. If you're around elderly patients, people that have immune system problems, people undergoing cancer treatment or chemotherapy, but also younger kids as well. So our newborns and infants, a lot of these vaccines, they're not even eligible to get them until they're 6 months old. So, and there's other types of vaccines that you can't get until you're 12 months old. So in particular, if you're around people with immune system problems, elderly, any of those things, but also around young kids, then that helps protect not only you, but also makes you less likely to spread it to them.
Okay, good advice, good advice. One other question, let's talk about timing. We typically see flu starting to peak around December, January, February in our area. So why get a vaccine now?
Well, flu season is very unpredictable. So right now it's October and we have relatively low flu activity right now. It's pretty minimal right now in our community, but we've had years where the flu virus started to pop up like in August. So it's hard to predict, like I'm going to wait until December when you can start seeing flu cases pop up at any given time. So what we tell people is that once it's available and you're kind of in the mood to get it, go ahead and get it while it's fresh on your mind. My experience has been that when people are motivated to get something, you tell them to wait until the perfect time, life will get busy, things will happen, and they tend to miss it. So strike when the iron's hot and get it whenever it's available to you.
Great advice. And speaking of advice, if somebody does have some additional questions, what advice do you give them?
You can talk to your regular healthcare provider or primary care provider, or you can ask any of our clinicians at the health department as well.
Okay. All right. Thank you so much, Dr. Reddick. I appreciate your time tonight. And you can also find more information about COVID, flu, and other vaccines on our website. That is coastalhealthdistrict.org/vaccines.